Now, when we move on to adolescence, teens can understand everything, which is good and bad. They can understand everything, but depending on the tough stuff that they've had to deal with in their lives, some kids have gone through a lot, and other kids, this may be their first experience with anything extremely stressful in the nature of a health threat or illness. And they may or may not be able to articulate why they're feeling awful. They may feel responsibility to help out around the house. Teenagers are often asked to do a lot to pitch in for the family, and that's fine. You may need that. They may need to take care of younger siblings. They may need to clean more, do more chores around the house, and if they have their driver's license, even help with driving other siblings to hockey practice. So teens are often thrust into the role of being a young adult very quickly, and other teens may run away from this responsibility. They find it overwhelming. So a lot of parents say that they actually have more arguments with some of their teenagers, and each teen reacts differently, of course. One sibling may step up and be over-responsible and try to hyper-function, which that has its own problems. And another teen in the family may run off with their friends and do things that teenagers do, like risky behaviors like drugs and alcohol and whatever else you can imagine and worry that your kids are doing. But often when teens aren't able to articulate how they're feeling, it comes out as irritability or anger or resentment. They also will sense if you're hiding things from them. It'll be very frustrating to them if you say confide in their aunt and not in them, because they want to know, they feel it's important to them, and they're able to understand. And so you need to talk to your kids about what it is that you expect from them, that it's what's their job and what's not their job. Their job is to help out on occasion, but you still want them to be teenagers and to be around and have fun and participate in things that they need to participate in, but understanding that temporarily they may not be able to do some of that. Also, when some teens cope by running away and being with their friends more than their family, you may have to step in and say, no, we need to spend some family time. One, if you do die, they may regret the fact that they didn't get to spend that time with you. And even if they feel uncomfortable, just letting them know that you do care about them, that you do love them, even when you argue, that people who love each other argue all the time, and that that's normal, and that you understand that. And maybe you'll have to write it in a letter if they're not willing to hear. If the anger and irritability is a continuing problem, then of course there's always services available here at Tom Baker in the psychosocial department. All of the therapists here do family therapy, and there's a few of us who specialize in children as well. So you can certainly call us, and there's the Teens Can Cope group that runs 2 times a year. But if you happen to see this or need help when it's not running, you can certainly call the department, and there are other services available too. I'll talk a little bit about that later. Another good question to ask kids when they ask you a question is, why do you want to know? Often kids will ask a question and you'll think it's for one reason when actually there's another reason why. You know, the real reason they may ask a question is they're wondering if they have to move, or if everyone at the school knows, or what will change. And a lot of the things that they're afraid of are how your cancer is going to affect their lives. Maybe they're not even thinking about whether or not you're going to live or die. So it may not be as dire as you think too. So that's another thing to keep in mind when you're talking to your kids, asking them why. With all ages, it's important to be honest with your kids. You can sort of think about kids having an internal lie detector. They can sense when you're not being completely honest with them. They have big ears, and they're always listening to the conversations that you have on the telephone or with your partner, or with any other adult family member that may be concerned and talking to you. So you always have to watch yourself if you're keeping secrets from your kid, because 9 times out of 10 it's going to get back to the child. And even if the news is not good, there's a way to give that news to your child that's reassuring. Worst case scenario, you know your cancer is terminal and you don't have much time left. You can reassure your child that you're going to make the most of the time that you have together. You're going to create some memories before you have to finally say goodbye, and that there are many people in their lives who love them, and that you want them to be close to the other important adults in their life, that it won't hurt you, that they're not betraying you by attaching to someone else. So no matter what it is that how difficult it is to tell your kids or have a conversation with your kids, it is important to be honest. If you do need help with that conversation, of course, you can call us as well. Sometimes depending on the situation, if you feel like you need to talk to someone about how to talk to your kids, that's something that we do quite a lot of. And then even with older children, you want to stick to routines as much as possible. I mentioned that with the babies and the preschoolers. But that's another important thing to do. It can be quite chaotic. The family can be quite busy getting you back and forth to appointments at the hospital and focusing on getting you better. But in the meantime, kids feel like they miss out on quite a lot. What can be helpful, for example, is to talk to another parent who can get your kid to different activities, especially if they also have a child in the same activities. Brainstorming different things like that to try and help your child not lose as much as they can. But that's pretty much impossible. Things are going to change. And you can worry that if the schedule changes, that's going to hurt your child. But most kids can learn to be accepting of this and realize that they have to take a temporary hiatus. If they have trouble understanding that, and you find that a lot of their grief over your illness is coming out in the form of being angry at that they can't do the things that they used to do, again, consult with us, and we can either give you some guidance or talk to your child as well, or have family therapy to brainstorm some solutions around that problem. Another thing that kids often tell me when I meet with them is that they are very upset by the side effects from the medication, particularly the pain medications. When their parent is out of it or loopy, that can be quite distressing to the child. And even some teens have told me I wasn't sure if she was ever going to be the same way again. And it's important to let your kids know that it's the pain medication. It actually makes you feel more comfortable, and it's only temporary while you go through this part of your treatment. So letting them know that it's a temporary side effect and it won't harm you long term, and it's surprising to a lot of parents, and was to me when I first started working here that was actually one of the more frequent complaints when I met with family, was just being so upset when they saw their mother like that and taking it as evidence of how desperately ill she was, when really that might not have been the case. A lot of parents wonder if they should tell the school, and the short answer is yes. But you need to make some things clear when you do talk to the school or talk to the teacher. One is you should tell your child that you're going to talk to the school and tell them that you're going to tell their teacher, but that the teacher's not to tell any other kids in the class about this if they don't want them to tell. And also that it's not the teacher's job to do the counseling of the child, that they may feel uncomfortable talking to their teacher about cancer. The reason why you want to tell the teacher is so that the teacher can be aware of any behavior changes in your child, or if their grades start to drop, or they're having more trouble focusing or concentrating, any signs of any difference at all, so that if their grades do start to drop, that the teacher can let you know right away so that you can intervene if your child's having a difficult time concentrating or whatever else is going on. When